Hello, it's my first time. Oh no, I'm a big liar. It's my second time going live on Instagram. I did so briefly for my birthday. I was trying to come live on Facebook, but it wasn't happening. But I really want to discuss autism, and have been setting up stuff to do so for a while now, but my urgency to come on today is because of this viral video with this child of 15 years old with mental illness who destroyed his mother's home. You know, that's the cause for me to jump on today. I know a lot of other parents and caregivers that suffer, and some people suffer in silence, but and some are willing to talk. I really hope that I can speak, and other people will be able to let their voices be heard about this topic. Hi, Marie. Hi, Omari. I see that you're here. Hi, Jillian. I really I'm expected to be on Facebook, so I want to share the video. I'm trying to share from my phone, so yes, my friends can join. Okay, it says message to I'm asking, please, Marie, are you still here? If you could share. Jillian, if you're still here, can you please share? I'm not sure if Omari is still on, but I left Omari wrapped up in my bed, sleeping. So shocked to see him jump on. Wait, you know what? Okay. Omari's logged in my phone, my other phone. So it's not Omari that is online. It's me. Now I realize. Okay. Omari just keep logging in on my devices. It's me. Now I realize. Okay. Omari just keep logging in on my devices. Please help me share. I don't know how to share. Like, who is here with me? Marie? Okay, Marie, can you send a link to me via WhatsApp, please, and then I could share it around? Thank you. I want to send it around on WhatsApp because other friends were okay. I didn't see it. Marie, did you send me the link? Marie, send me the link to this live via WhatsApp, please. Oh, you don't know how to share the live? Oh, wow. All right, take your time. So it shows that we're it's all foot in action, Marie. Oh, Lord. I mean, I know what we're doing over here now with these millennials. For them to come and laugh at us. It's an old foot thing going on right now. I realize that. Look at my head, how it's big on this. I think I have Ethiopian features. Hey. Hi, Ruthie. I don't know. I don't know what is happening with me on Facebook. Thanks for coming over. Okay, I'm just typing here, trying to share. I am on Instagram now discussing autism and related illnesses. Thanks. Okay. And please share as much. You know, I'm not established. So I don't have a following. I'm gonna share my link now. Okay, I'm gonna share it with you on in WhatsApp also, Marie. It's in our group, Ruthie. So I'm just gonna share around, and I ask you guys to do the same thing. So, you know, we can gather our grouping, our little group, to discuss this silent killer. It sounds rough to say so, but it is. It is because your health actually deteriorates. And today I spoke to a mother, and when she started talking, throwing out, like, she's like, oh, I went to the doctor, and you know, and she was talking about her blood pressure or blood sugar level, and then she spoke about she just finished chemo, and she's just going on, and I'm like, hold on, stop. I just heard three things. I heard cancer, I heard diabetes, I heard high blood pressure, and yeah, what's going on? And she said, girl, there's a lot more. So it's not easy. It's not easy at all caring for our special babies. They're a part of us. We love them. I mean, other people deal with the situation differently. But for the parents who continue to care, that the parents that it's very hard to let go. And sometimes it's not even hard to let go. Sometimes we are willing to do placement, but you just can't find that place. You can't find the people that you feel like you will trust. So it makes you continue doing it, because I have approached that before, and I've actually done residential with Omari when I when I got him back from Las Vegas. There's some people here know the story. When Omari was taken away from me back in 2017, and I fought and I put up a fight to get my son back. I got him back from Nevada, but even prior to that, I was willing to do placement, because it's just too much, and it was wearing me down, and it still is. But that's what made me back then made up my mind. And then, like, there was so much events that occurred in our lives. Back in 2015, we were displaced because of a fire, and he was involved in a school bus accident. So with his behaviors and the autism and then the PTSD, it was just too much for me. It was just overbearing. And I did make my mind up to do placement. But it's finding the right people, the right home that makes you feel comfortable, and you don't have to feel that guilt, placing your child. But when you place your child in a setting and everything is not right, you just won't feel good, So that's what really caused a lot of us parents to still cling on and suffer daily. I suffer daily. Stuff gets broken in my home, and I'm not rich. I'm coming from a humble beginning. So for me to be constantly losing stuff daily, it's hard. But the love for my son is greater than the material stuff. But it's still hard to lose these stuff daily. And I wish there could be, more trustworthy people who open group homes, and to make it easier for us to make that decision and live. Because as I mentioned earlier, the mother I spoke to today, she's battling so much illness and still have to deal with her son's behaviors. And her son's behaviors is just like my son. He breaks stuff. And And another thing, it's much harder for us parents with kids that are aware. When your child is high functioning, it can be a blessing, and also it can be like a curse. It's very hard because they are so aware that something is wrong, and they're different from their peers, they're different from others, and it causes them to act out more. It causes them to be frustrated. Their frustration becomes your frustration. Oh, thank you, Mary. Thank you. Yeah. Thank you, Frank. Oh, thanks to all my friends that are here listening to me. For who just joined, I'm talking about, autism and behavior issues, and the drive to do so is that viral video. I was already preparing myself to start discussing these things, but that viral video where this 15 years old boy mashed up his his mother's house, like fully destroyed. The toilet is broken, the kitchen island, the, what do you call it, ceramic, piece of that he broke. I really would have liked to see him in action to see what he used, but then I'm not surprised because I have one and he gets real violent. And my son uses forehead and bumps in the wall, and I've seen him break sheetrock with his forehead before. There's always a mark here. No, it's cut because he's been bumping his forehead a lot and it's been bleeding, and the more it bleeds, the more he bumps. So I sympathize. I don't know what's going on. It must be something terrible going on in his head for him to want to constantly bump his head. I'm so feeling that mother's pain. I wish I could reach out to her. I wish, well, by now I'm quite sure there must be some outlet that is letting her know that she's not the only person going through this, because a lot of people are suffering, and some people are suffering in silence. There are people on this live that have kids with autism. There are people on this live that have family members with mental illnesses. So they know. These are people who have supported me, people who have spoken to me, and encouraged me over the years. So I do know that. And I want to say thanks for joining in with this discussion. I do not have a big platform and a lot of followers, but I'm just starting because I always feel the need to address what we go through. Okay, you say her son need alternative. Okay. Support. Yes, I do agree, because it's a lot. And also with the right resources, like right support too, he could get help and stay home, the right medication. But I listened to Andre Stevens live last night, and someone called in and was saying these medications are trial and error, or and it's true. Omari's behavior started in 2014, And since 2014, they have yet to find the right cocktail, the right medication. Since 2014, the only thing that has given me control is since March, I started giving him marijuana. I got a prescription. I paid out of pocket. I got a prescription, and I went to the dispensary, start buying marijuana, and it's been very expensive to maintain. It started out where I was spending about 500 something per month until it increased. In June, prior to going to Jamaica, my bill was over $900, and I was still going, and his behavior increased. I drove across the country because he could not manage a long flight, like a 6 hours flight, and it was just us, and I didn't really want to disrupt a flight, and I'm already scared to fly these days. I just don't think it would have been fair for other travelers to go through that. So I drove. I spent days on the road with them, and there were a lot of episodes, a lot of outbursts, and I bear with them. There was another lady who called in on Andre Stevens' live, and she spoke about her son. She lives in Jamaica, and she spoke about similar behaviors. And one of them that is very scary is when my son attacks me when I'm driving. Yes, I go through that. And that's the reason why I made a decision to purchase the vehicle I purchased last year, because of a safety feature that was working. It's no longer working. When I go to the dealership, they're telling me that that's how it is. Sometimes it can stop working, and that safety feature is, you travel in the front passenger seat with me, and I was able to lock the door. So while I'm driving, if he tries to open the door, he can't. And that stopped working. So sometimes Omari try to pull the door. Oh, let me back up and read. Oh, yes. Thank you, Mary Andrea. Okay. Young Rose, for him to destroy the house like that, he needs medical. He definitely needs medical help, Young Rose. And I don't know the situation with the mother. We don't know. Who knows? Maybe she didn't have him on medication. There are lots of parents with mentally challenged kids, and they live in denial. You know that? And they don't seek the help. Amari breaks stuff, but it's never been at that magnitude. I mean, that's a lot. That was a lot. So we really don't know the full story. I would love to hear the full story, for it to escalate and get there. What was his frustration? It could be a lot of stuff. It could be someone new in his space. It could be a big trigger. Like a friend of mine in Pennsylvania, because Facebook is not working. I'm going to try to see if I have her in my phone and shoot her a message, because if she could come on air, she could explain some stuff. And she mentioned on my Facebook post about her son that will have things building up inside until he just acts out. We just don't know what happened there, And anyone want to join the live? Anyone that want to share their experience? We're all welcome. Everybody's welcome to just speak on the topic. You can call my phone if you have my number. If that's how you prefer to do it, then join in the live. Let me try to shoot my friend a message. Okay. I'm not seeing a picture here, so I'm not sure. Okay, I forwarded that. Okay. No one wants to join Andrea. Hold on. I'm just going to put you on the spot and call you. Let me see. Because Andrea, yes, hello, Andrea. Are you still watching? Mm-hmm. You're still watching? Okay. Okay, I'm going to put you on speaker. You could share your knowledge, with the viewing friends. Hold on. Yes, hello. Go ahead. Meet Andrea. Andrea's been my friend for a lot of years. Since the elementary. Our kids were both in the same classroom. And we met dropping our kids off at school, and we've been friends for so many years. And also, she have a medical background, so I'd like her to speak more on the topic, Yeah, go ahead.
Okay. There was a point that you touched on where they said that the kids might be holding, they hold that stuff, or like I used to term it for my son is that he holds a grudge.
Mm-hmm.
As I would say, my son is also autistic. He's nonverbal.
Everyone is hearing? Okay, well, can someone respond and say you're hearing well? Hearing the phone, please? Okay, thank you very much, Ruthie. Yes, Andrea.
Okay, so my son is he's an adult now, and he is nonverbal autistic. And I used to say when he was younger that I used to call him my little genius, because although he was not speaking, his actions used to speak louder than words. I could see certain things. I could see when his mind is turning, or when he is thinking of things, or when he's about to do things. And we're talking up until the age of 16, where he was not fully potty trained. But he's a handsome little fellow. And so when he goes out in public, everybody used to be, oh, he's so cute, he's so this, he's so that. But then when he opens his mouth and starts to screech, because he has no formal verbal communication. So it was mostly screaming and stuff, and especially when he wants stuff. And we had to start him on medication early, because he used to have seizures, and then he developed sort of an aggressive behavior, started getting a little bit aggressive when he was younger. So he would hit. And when he would hit in the face. Like he would slap you in the face and stuff like that. So I used to warn people. I used to tell people, don't go too close to, don't go too close to him, because I don't want him to slap you. And then people, oh, he's so sweet, and so forth. I had an incident one time when I went to the pediatrician office, and this son was about 10, 11 years old now, and he's there feeling up my pediatrician's beard. And I said to the pediatrician, please stop letting him do that. And he said, no, he's okay. I said, please stop, and I was trying to talk to the pediatrician to let him stop. And all I know, 2 minutes later, not too long after I said it, my child hauled off and slapped him in the face, and he was just like, he couldn't believe it, And I said to him, this is where we come in, whereas people don't listen to the parents when they're speaking to them, They don't listen to the parents at all.
Hi,
And
Raquel, Kiwi, Marie. Yes, go ahead.
Yeah, and it seems as if we're not. It seems as if they feel like they know more than us as the parents. And even when your child goes to school, here we have what's called an individualized educational plan. And each child is supposed to have that plan in place because that plan is specific towards that child and the education that they're supposed to receive in. And a lot of times as parents, when you go into these meetings, they want to tell you what they're going to do with your child. And it's supposed to be an agreement between the child and the parent about the plan.
So it's structured around your needs and what you really want. But I know exactly what you're saying because I experienced.
They want to tell you what they believe is right for your child.
And you know what? I just a minute. I'll just tell you, I didn't understand my rights, so they were able to force these things on me their way. For so many years. Yes, go ahead. You touch a good, valued point there.
Yeah. So, with that saying, sometimes I used to go in. I remember when I went to the meetings, they used to have the go-between people. So it was the teacher. You would have a support. It's supposed to be the support. The supports coordinator for that school when it comes on to autism and stuff like that. And then you'll have your speech therapy, your occupational therapy, and physical therapy if your child needs that, and so forth. Now, there was a situation, because my child is nonverbal, a part of my thing with my child was that I know this is who he is. He might never be a brain scientist, he might never be mathematician, he might never, I don't know where he's going to be at. So my thing was, I wanted my child to be functional. And when I say functional, I mean, I'm able to take him out on the street. He can sit down at a table, eat with a knife and fork. He can put on his clothes properly, button his shirt, zip his pants up. These little functional things, that's what I wanted, versus an academic education, knowing ABCs, 1, 2, 3, blah, blah, blah. And I realized they have to teach them these things too. So, okay, I'll incorporate a few of those in there, but I didn't want too much of a stress and strain on him. Get him functional first, and then we can teach him ABCs, because my belief is that if we should look back at our babies who are normal, what do they do? What do we teach them first? We teach them how to go to the toilet. We teach them how to pull up the pants. We teach them how to put on the clothes properly. These are the things. So if our kids can't do it at a certain age, why aren't we going back to that point and then bringing them forward from there? That wasn't happening either. No, nobody wanted to listen to me. At one point in time, they were teaching my child sign language, in which I was agreeable for them to do. But a part of them teaching my child sign language, I wanted him to be able to use please and thank you. So if he wanted something and he was requesting something, not just pointing to that, but also incorporating the word please in there. And then once he receives it, to say thank you. I had somebody that turned around and look at me, is that absolutely necessary? And yes, it's necessary for me because that's my child. That's what I want him to learn. It's not what you want him to learn. It's not what you want him to do. Mm-hmm. At that point in time, that was my child. Mm-hmm. That was supposed to be individualized. If it's an individualized educational plan, it's my plan. Mm-hmm. And so that's the way how I used to deal with stuff when it came on to that. Let me move forward and touch on medication, because as I said, I had to medicate my child from early. And It wasn't something that I wanted to do, but it's something that was necessary because he had seizures and he was also displaying a lot of mood disorders or, as I would say, aggressive behaviors. So, as Lorraine had said, that I have a medical background, so it was a good thing where that part of it was concerned because I would research. They weren't just gonna give my child any pill or anything, and I did not go research what are the side effects of it. What should I be looking for when he's taking these medication? You know, is it going to make him sleepy? Is it going to make him drool? Is it going to cause him to have diarrhea? Is it going to cause him to you know, any little side effect, vomit, you know, any things like that. So I would look out for side effects, which is important when you're medicating your child. You have to also know what are the side effects of this medication. Some of these psychotropic medication does cause them to have suicidal ideation, in which the doctor don't tell you that, but it does cause them to have it. But we have to look at what is outweighing the good. So if the medication is working, but it's causing him to have suicidal ideations, then we need to investigate getting psychological testing, whereas you have a psychologist that is also following your child to help them, to give them tools in which if these suicidal ideation comes up, which means that they want to commit suicide, they'll say, I feel like killing myself or whatever. Don't take those words lightly, because as we can see in society today, even normal people are killing themselves. Right? So
Sure.
what can we say? We have to take these things seriously and into consideration. So we also have to seek out an additional person to help them when it comes on to that. So is there any questions that anybody wants to ask or anything? I think I've spoken enough and spilled enough.
Anyone wants to ask anything? Anyone, you know, dealing with you know, a family member, a friend, situation, and you want to ask a question that you could share? Okay, no. I'm just busy on the phone, trying to reach out. Okay, well, thanks, Andrea, for that. Can we like discuss triggers, like, you know, being that the video is what really put us here, like triggers, what could really trigger, what causes triggers, you know, for kids to behave the way they do? Because you were preparing me a long time. You told me these things, you know, would happen, but I did not believe you. You know, a lot of things that you told me, you spoke to me about, I argue with you about it, and then they come to pass. And you know, just a few days ago, I took Amari in for his shot, and I did explain the same thing to the psychiatrist, you know, about you always advising me over the years about stuff, and I was I just disbelieved the stuff you said. But then, you know, they all come to pass. So could you like prepare anyone? Another thing I remember, yes, you had prepared, you were telling me about, you told me what to do for when puberty. I did not do it. That could have prevented these behaviors. What was that?
I have to go all the way back. I think at the time when you didn't, at one point in time, I don't think you wanted to put him on any medication. It wasn't until when it got real serious for you. I don't remember. But puberty, when it came on to puberty, that is usually at the time in which most of the behaviors come out. is when they hit puberty. That's when they can either calm down or they can go get aggressive. And I think that's what I was trying to explain to you at that time. Is that either way it can go. So you have to watch out for it. But at the same time, you have to try to get them into therapy. In not only therapy, but if they're having medication, yes, they need to have therapy also with it. And we used to talk about ABA therapy at the time. There's a couple of therapies that they were doing, which was ABA therapy and something that was called discrete trials. Discrete trials usually help them when they're younger because it's breaking down each thing into the smallest component and then building from there. That's what discrete trials was about. ABA therapy is more about, I would say, it's almost like a reward and punishment. Well, not punishment. We don't call it punishment. It's not punishment. We reward them for a behavior that is well done. So we always talk about looking at the positives and building from there. So when the child displays positive behavior, we acknowledge the positive behavior. We praise them for the positive behavior. And we don't discuss the negative behaviors. Like we don't go back and say, well, remember you did that yesterday and I didn't like that or whatever. We don't do that. We just reinforce the positive behaviors. So say, for instance, if the child got a good grade in school, or let's put it in terms of a child who has aggressive behavior. Say, for instance, if they went through an hour and they did not display any aggressive behavior, yes, or at all or so, you can look at them and say, oh, I see that you're in a great mood today. What would you like us to go and do? Something like that. So we're not talking about the negative part of it or anything like that. We're just dealing with the positive. We're not going to let them know that we realize that, oh, you didn't destroy anything in that past hour. We're just going to reinforce the good behavior by rewarding them with something that,
So you encourage the good behavior.
Yeah, to keep encouraging the good behaviors.
Okay.
So basically that's what that part of it is all about. I think I was talking about ABA therapy and what it really does. I want to put it in a different terminal. I'm trying to find a different way of also explaining ABA because it's more to it. There's a whole lot more facets to it than what I'm trying to express.
Like I remembered when I lived in Elmsford, and it was hard for me to direct Omari to, doing stuff the way I wanted him to. And ABA therapy was referred and I utilized it, and it made a big difference. Like the ABA therapist lets him know that at 10 o'clock the television turns off, and she told me to buy a lock to put, because I had the armoire and I could close it, and she said, okay, put the lock on at 10 o'clock, put the keys away. And then she set up his routine in the morning, and she let him know, buddy, this is how it goes. You get up, you're gonna brush your teeth, do whatever. If you have to shower, change your clothes, get dressed, get something to eat. And, after you've done everything and it is satisfying to your mom, is when the lock comes off. I could not do that myself. He would have, attacked me. He would have been aggressive. So, having someone other than me to reinforce certain things, rules and stuff, I find that it was very helpful.
Okay. So that is called building structure. So
Yes.
basically it was structuring his day. So basically he would be aware of everything. When our kids were younger and they started elementary school or so, they wanted us to structure them from then. So it wasn't that when they came home from school, You had things that you needed to do. So when you come home from school, you put your backpack away.
Yes.
And ABA therapy would, if the child is nonverbal, they'll put these in picture forms. So the child can visually see what they're supposed to do. When the child is verbal and can speak, they'll do both picture, the wording. So they'll still have the visuals. They'll still have the vocal, and they'll still have the things that they need to do it. But what they'll do is just completely structure it. So at 7 o'clock, you wake up at 7 o'clock. The first thing you do is go to the bathroom, wash your face, brush your teeth. Then the next thing is take a shower. After you take a shower, you come, you sit down. Whether they're going to sit down in there, it depends on how you structure yourself or how you want them to do it. They don't have to totally get dressed, but if they have on a shirt and a shorts, they can sit down at the table, have breakfast. Then they can get dressed, get ready for school. School bus comes at 7:30. So all of this has to be done between 7 and 7:30. It is fully structured. You go to school, you go on the school bus, you go to school. The school will have their own structure because that's what they do at school. They have to go in at certain time, blah, blah, blah. And then they leave those centers and they finish up and time to get ready to come back home. And then when you come home, you have your structure, whereas you have to put your backpack in the correct place, put your shoes in place. You know, they can't, even if they have downtime, whether you're going to give them a snack as soon as they come home, or you're going to let them relax and go play, so they'll have some time to have a free time to do whatever they want to do. And then after that, say another hour, then it's time for you to wash up, get ready for dinner. And then by 7:30, it's back to bed. Wake up back at whatever time again in the morning. That's what the structure of the day is supposed to be like.
Right. And
they found,
okay. No. Go ahead. What I wanted to intervene and say is that, I was told that autistic kids, they do better if they they have the structures, the routine daily. At first, it was hard for me to adapt to that. I was thinking, I was like somewhat offended, and I think it's my Jamaican background.
You weren't the only one, because I was the same way too.
Really? I
was the same way too.
Okay. And then I learned the hard way. I didn't know. It's good to share these. I was offended by some of these things that they introduced to me in the beginning.
It was, how dare you tell
me? Thank you.
My child.
Yes, absolutely, Andrea.
I was the same way too. I really was the same way too. I resisted it for how long? Believe me when I tell you, because I used to say, but our world is not full of structure. We don't, if you're going to cook and you're out of rice, you have to leave and go to the supermarket, but he's going to have a fit because you have to go to the supermarket and they're not going to get to finish the schedule, and because that kind of triggers if they have that regimented thing, and then you stop what they're supposed to do in that time. So, yes, I resisted it.
Yes, because I am not the person for any structure. I am
Oh, yes, I resisted it. But remember, even the other day, I was trying to explain to you that it seems as if Omar needs to have routines again. So when he gets home from school,
absolutely.
Whether you're going to take him to he needs to know exactly what he's going to do. And that seems to be what he's crying out for.
Yes.
Right now, you know what I'm saying? So you have to kind of plan your day so that it eliminates these episodes. Not saying that episodes can't happen or it won't happen,
but it will lessen it. Yes.
It will help to soften it a little bit. It will help to lessen it, because I don't want anybody to get offended, but this is how I turn my child. So don't get offended. I said my child is crazy, nuttier than a fruitcake, So guess what? I don't know when he's going to flip on me, but I have to be prepared for whenever that flipping happens. You understand? I have to be prepared. So what am I going to do if I'm driving on the street? You know, I make sure that he's in agreement with whatever structure, whatever we planned. You know what I'm saying? So, for me, the way how I used to structure my child in the evening was I used to take him to a lot of therapies. So after school, I was racing to pick him up to go to this therapy or that therapy. But at the same time, I also have a typical child that I have to deal with also. And my two children are very close in age. They're 16 months apart. So they're practically the same age. So when my daughter was I put my daughter in ballet at one point in time. So she did ballet. And guess what? My son had to come along with me because although I was married, I felt like I was a single parent because everywhere I had my Louis Vuitton and my American Express with me wherever I was going. Those were my two kids. One was the Louis Vuitton and one was the American Express. I can't leave home without them.
Like Amar's my deodorant.
I cannot go to the bathroom without them.
Okay.
So it's like I carry my purse and my thing there. You know, well, at least one of them at one point in time, I could put down the purse, but the American Express was there all the time. And that's what I was doing. If I was on the toilet, if I didn't have any time, I didn't have no time to myself or anything. But the only thing that I could do at that point in time, I discovered that my child loves water. So guess what? If I wanted some when I say me time or whatever, because I'm trying to at least not having somebody sit in front of me staring at me while I'm sitting on the toilet, I would turn on the bathtub and put him in the bathtub. And then I would bring a big sheet in there because it was a whole
open.
It's like you went to the pool.
Oh.
So he would jump in the bathtub and the whole place would be wet. But I had to be prepared for that.
Right.
So my bathroom was always clean because there was no dirt on my bathroom floor because he would splash the water so much, or he would go in there and bathe himself sometimes. And guess what? I had to come through with a mop to mop it up. You know, but at least it lessened the time for him to act out. In other words.
Yeah.
You know? So I kind of floated and moved with emotions, you know? And sometimes we have to watch our kids and see what they like, what they dislike, and then just go with the flow, you know? And so forth. So for you, I know Amari likes music and singing and those things. So he has to have time in his day that is structured for him to do that. You do it at this time, from this time to that time. And then from that time to this time, we're going to do something else, you know?
Yes.
But right now, I think for him, it's going to...
But
he needs that structure because he has to be occupied at all times. If he's not occupied, he's going to, you know.
Yes, and the thing is, mentally, I am not good. I'm not there. I mentally to do all of this because I'm worn out. So that's where respite would help me, you know, because I just can't. I can't keep up with all this because my depression, you know, I suffer from depression, anxiety and depression, and you know, it just won't allow me. I cannot. So someone else is needed to do this.
To help you with the anxiety and depression or whatever. There's a time when you get respite care, you have to do your self-care, which is at that time you can't get respite and stay in the house with respite. You kind of have to leave the house. So whether you're gonna go grocery shopping, go get your nails done, you know what I'm saying?
Yes, and that's something. Yes, I would definitely utilize these things because problem that I'm having now. I mean, you know, like sensory issue with Amari. Yes, there are times when it's not affecting him that much, but no, it is because he doesn't want to be in Walmart. He doesn't want to be in Costco. He says it's too much noise and it bothers him and it triggers him. even leaving him outside, in the vehicle, he says too much people. It's just too much. But what happened too, he, by accident, saw a video, and I think it's fear also. So when I was getting him to the day program, there was a time when I wanted to go into Walmart, and for more than a month I was not able to go to Walmart and grab the stuff over the summer that I needed, because I drive there. I even take him to Starbucks. He loves Starbucks. Giving me Starbucks and say, okay, this is chill for him, so I could run in and grab a few stuff. And then he's like, no, 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 no. We gotta leave. We gotta leave. So, there, triggers that.
Amari needs a lot of he needs help, and he has to, not only the psychiatrist alone. Psychiatrist is only going to give him medication, but he needs a psychologist also. And that's what a psychologist is going to do, is going to talk to him. Because at this point in time, that's what he needs. He needs what we call talk therapy, in other words, so he can discuss things, and then the psychologist can hear what he's saying, and then try to help him. When I say try to help him to figure it out, in other words, because he might be confused with certain things, or he might not understand certain things that he's seeing or hearing, because he does not process the stuff properly. So somebody might be looking at him, and he's not processing the way that they're looking at him, that they're not even truly looking at him. They're looking at the car itself because they like the car, and he thinks that the person passing by is looking at him in the window, is looking at him.
Yes.
And probably thinking something nefarious, you know what I'm saying?
And
that's going to trigger him.
And the same thing, but that's something that I see in his grandmother, She always feel like people are trying to hurt her, and
So that's a part of schizophrenia, a part of, I can't diagnose, so that's why I said, you have to take him to a psychologist for them to really get to the nitty-gritty of it all.
Well,
it's not fair for me. He's not a patient, and so it's not fair for diagnosis, but you have to take him in. He needs to see a psychologist so you can get to the bottom of everything that is going on. Because, and the wonderful thing about it with Amari is that he can speak for himself. So they'll be able to decipher it for you and decipher it,
yes,
and figure it out. The only unfortunate thing that happens is that because they're bound by code of ethics and stuff like that, and because of his age right now, they're not going to be able to tell you what the session was like, or what happened, or what he said, the only thing that they'll come out is if they come up with a plan and they gave him homework, they'll kind of tell you what the homework is, and for him to follow it through. You understand? For it to follow through.
Okay.
So that's when they will introduce you into it. But they would not tell you what he says during the session. They will not tell you, how the session was, whether it was okay. They won't tell you anything. They'll just, unless they gave him homework or so, they'll, something that he needs to do. And then they'll even ask him permission. Can I say to your mother what you have to do or whatever? And then at that point in time, they'll introduce you in on it. But they'll try to give him enough tools for him to be able to work things out. Because it is a good way for them to, once he starts talking, they can get a good read on what is happening.
Right.
And they're the only one that can do it. You understand?
Right.
Now, if he gets a formal diagnosis, yes. If they come up with a diagnosis,